Can lack of sleep cause erectile dysfunction? As we mentioned earlier, a lack of sleep can certainly impact your mental and physical health, including sexual health. So can sleep deprivation cause erectile dysfunction or other sexual dysfunction? Sexual dysfunction can include a lack of sexual arousal or interest in sex, not being able to climax, and in some cases can even include sex that's downright painful erection. Lack of sleep could be a possible cause of erectile dysfunction. Chronic sleep disorders like insomnia or sleep apnea can be a risk factor and accompany ED. If you struggle to fall asleep or stay asleep, or if you don't get quality sleep, you may be dealing with insomnia. Other insomnia symptoms include laying awake for a long time, only sleeping for short amounts of time, or waking up too early in the morning. A lack of sleep and disrupted sleep, common insomnia symptoms, have been linked to a higher risk of erectile dysfunction. Sleep apnea is a condition in which your breathing stops and restarts multiple times while you're asleep. There are two types of sleep apnea: obstructive sleep apnea. The most common type of sleep apnea, obstructive sleep apnea, occurs when your upper airway becomes blocked and airflow completely stops or significantly decreases. Central sleep apnea. This type of sleep apnea happens when your brain doesn't send signals to breathe and may be caused by health conditions that affect how your brain controls chest muscles and the airway. A 2016 study also found that obstructive sleep apnea is associated with a significantly higher risk of erectile dysfunction. Disrupted sleep, whether from sleep apnea or another sleep disorder, can also affect testosterone levels. Testosterone levels are generally at their highest during REM sleep, a stage of sleep associated with rapid eye movement, REM, and dreaming. This disruption to levels of testosterone production could lead to hypogonatal symptoms, a condition where the body's sex glands don't produce hormones, and can potentially cause erectile dysfunction. Sleep deprivation can also affect your sex life by exacerbating mental health concerns like depression and anxiety. Mental health concerns can often influence sexual desire in men, and there can be a strong connection between erectile dysfunction and mental health concerns, as a 2015 study found. Poor sleep or a lack of sleep can also lead to relationship issues, which can then affect sexual health and sexual activities with your partner. A lack of sleep can heighten stress and cause conflict with a partner. Another way a lack of sleep and ED are connected: work schedule. Working non-standard hours or night shifts can throw your circadian rhythm, the body's internal clock that carries out essential functions, out of alignment and interferes with bodily functions, like sexual function and erectile dysfunction. What to do about lack of sleep and ED? Now that we've determined that sleep or lack thereof can affect erectile function, let's talk about the ways to right the ship. Treating sleep deprivation. Since a lack of sleep and ED are connected, improving both can help your sexual health and overall well-being. Improving your sleep can start with talking to your healthcare provider. Diagnosing and properly treating sleep disorders like sleep apnea can help improve sleep and therefore may improve